Hello, everyone. Today we're going to be talking about how you can transform your workplace healthcare. Now, before we go any further, let's just be very clear on who we are here to serve. So, if you are a solopreneur, put a solo into the chat because, yes, we're going to be talking about serving you. If you are an independent contractor, do you get a 1099? Yes, we're here to serve you. If you have a small business, maybe your partnership or an S Corp or a C Corp, but you have less than 50 employees, then definitely you are in the right place. So if you are an independent contractor, put IC into the chat. If you are a small business owner with less than 50 employees, then just put SB into the chat. So let us get started because I'm super excited about helping you to find a way to provide better benefits at a lower cost in order to create happier, healthier employees. The employers that we work with save on average at least 31% with regards to their healthcare costs. And we are especially looking to serve those of you who have wanted to provide healthcare to your staff, to your team, to your employees, but it has just been beyond your reach before now, right? So hopefully you'll see that we're going to give you an opportunity to be able to provide the people that you serve with an opportunity to improve their health and well-being. Now, the current statistics are that the average cost per employee for an employer's healthcare coverage is over $7,911, almost $8,000. And about $1,300 is the employee contribution on average. The other thing to keep in mind is that there's an annual increase rate of about 6.5%. Each year, it increases another 6.5%. And as horrible as this seems, on top of all of that, you're paying an average of about $300 per employee in just administrative costs. So now, when we look at the impact that these types of costs have, we also need to take into consideration other things, such as absenteeism. More than $225 billion are spent to cover absenteeism. So, in spite of all of this money that you're spending on healthcare, you're still having to spend additional amount of money for people who are out due to sickness. So there is a 57.5% productivity loss in addition to that, because sometimes, our employees come into work, but they're not fully there. They may be sick, under the weather, they may be worried about a child at home or spouse at home. And so they're not really being fully productive on the job. And productivity loss also leads to $530 billion a year nationwide due to poor health. Now, when we break down the cost of traditional healthcare plans, about 15 to 25% of those healthcare plans are in administrative costs, as I mentioned before. Network markups, meaning, your insurance company marks things up, the pharmaceutical company marks things up in terms of the drugs that our employees are utilizing, labs mark things up. All of these markups are between 150 to 400% markups. And like I said, prescription drug markups are notorious for being anywhere from 80 to 300% in terms of markups. And then, of course, in addition to all of these costs, they're also going to add at least about $1 per claim for processing the claims. This leads to significant decreased satisfaction for our employees. More than 72% of them want more personalized care options. 70% consider benefits when choosing jobs. And 67% want better healthcare options. And only about 54% actually understand their benefits. So the whole landscape of health insurance is utterly complex and confusing, number one. Number two, it doesn't give our employees the benefits that they really, really want, because they want more personalized care as opposed to just cookie cutter recipe plans. And the big thing that I want you to keep in mind, especially for those of you who are not yet offering your employees healthcare benefits, 78% of our employees consider benefits when choosing a job. So now the rising issues that we need to consider when we sum it all up together is that there's a 6.5 increase annually on average from year to year. The administrative burden of managing these complex, unwieldy plans usually take around 4.4 hours per week, depending on how large your staff is. And satisfaction is only about 3.1 out of 5 on average. And then the other thing to consider, like I said, as if it wasn't bad enough, right? Is that a lot of our employees just have difficulty getting access to healthcare. When they book an appointment, they have to wait on average about 26 days to be able to be seen by their healthcare provider. Now, remember what I said. There are all of these different costs when we look at healthcare, you know, the obvious costs, as I said, in terms of the premiums and things of that nature. But other things that we want to consider, the indirect costs, the hidden costs that are under the surface that a lot of times we don't take into consideration, are things like the paperwork, as I said. A lot of these insurance plans will charge you $300 a year per employee to manage the plans. Compliance management is sometimes as much as $1,100 a year. Other costs are things like I said, sick days that our employees are taking because they're still getting sick. Keep this in mind. We live in the most unhealthy industrialized nation in the world, which is bizarre because we spend more per person on healthcare than practically any other industrialized nation. And yet our health outcomes are worse than everyone else's. The chronic illness in this country is upwards of 80%. And these type of chronic illnesses lead to those types of lingering sicknesses that result in sick days. Around $225 billion, remember, as I said, per year is spent in our nation because of sick days. In addition to the fact that, again, our employees are overwhelmed. Many of them are dealing with emotional issues, depression, anxiety. Many of them are overwhelmed taking care of their elders, taking care of their spouse, taking care of their children who are also sick. And so these are some of the hidden costs that add to the challenge of what we refer to as the overwhelm of a broken system. So now, what I want us to look at are some of the other links between benefits and being able to retain the better employees in your business. Consider the cost of replacement. 33% of an employee's annual salary is spent recruiting new people, training new people as you onboard them. On average, about $15,000 per employee, and about 42 days to be able to fill positions when employees leave. Because remember what I said, one of the major things that employees are considering when they're on the job with regards to their satisfaction are their benefits. And you'll recall that I said that many of our employees are dissatisfied with their benefits. And so they go shopping around for another job. And that is why it is so critically important that you consider how can you better customize the healthcare benefits for your employees And if you're not already offering those healthcare benefits, how can you start to offer those benefits to be able to retain better staff? And 72% say that they will leave in order to get better benefits. In fact, 80% prefer benefits over a pay raise. So please recognize that this is a significant challenge to your business and can significantly impact the quality of your business and the productivity of your business. So I'm here to share with you an innovative new approach to healthcare that can lead to 31% on average cost reduction, an increase in employee satisfaction of about 89%, reduction of administrative time of 60%, and most importantly, not only will you have happier employees, but you will have healthier employees on average, an improvement in health outcomes of about 45%. And that is because we focus on prevention. When you focus on prevention, you reduce absenteeism, you increase productivity, and you reduce healthcare costs. Some of the unique components that we have in our innovative model is that our model is based primarily on a health risk assessment that is done at the very beginning of the program and done subsequently every 6 months. From this health risk assessment, we're able to design and customize specific wellness initiatives that are tailored to the needs of your team members. And most importantly, to be able to create early intervention so that we prevent the higher ticket items. Remember what I said about the fact that about 80% of the costs of our healthcare in this nation today is relegated to chronic illness. But guess what? The beautiful thing about that is that chronic illnesses are preventable and in many cases reversible. And that is what we specialize in. So what we're focusing on is improving also the way in which the benefits are rolled out so that your team has a better understanding of what their benefits are. And this will lead to an improvement in their satisfaction and an improvement of the people that they're working with, the healthcare providers that they're working with, and the accessibility to those providers. This is because our programs are virtually based. And in fact, we focus on preventative screening and preventative services. And the majority of your dollars are going to be spent on wellness programs that help people to become happier and healthier employees. Our current healthcare paradigm is focused on disease management. Let's just be real. Let's just call a spade a spade. When is the last time that you've heard one of your employees say to you, you know what, boss? I don't have diabetes anymore. My blood sugar is perfectly balanced. And guess what? I'm doing it without medication. When is the last time you've heard one of your employees say, hey, boss, my blood pressure is beautiful. And doc says everything looks fantastic. When is the last time you've heard your team say to you, you know what, boss? I'm spending less money on medications this month. Isn't that fantastic? Well, these are the things that you can look forward to hearing from your employees. So, what do you prefer? Do you prefer having to spend more and more money each year on healthcare for your employees? Or would you like to see a reduction in that cost? a reduction in the administrative cost, an increase in productivity, higher engagement, not only on the job, but also higher engagement in the healthcare plans that you are providing to your employees. Let us break down the implementation strategy that we have. We take about 2 weeks to do assessments because there's no point giving your team cookie cutter recipe. In fact, that is why many programs fail, because they are not customized. They're not based on the risks that each individual employee is facing. And indeed, as a small business owner, you want to definitely look out for this distinction, because it is only when your healthcare program focuses on a risk-based approach that is customized to the individual needs of the team member that you can have it as a complete write-off on your taxes. And I know that sounds good to you, right? Now, after we have the assessment period of about 2 weeks, then it takes us about another 3 weeks to onboard the people in your team, because we want to make sure that everyone on your team is crystal clear about the benefits that they have available to them. And we want to make sure that they feel excited about engaging in the plan that you have spent money investing into them. And then it takes about another week to have it fully launched, where everyone is integrated into the plans, into the programs, in a way that it is meeting their specific health needs. And by 90 days, we're full blown into the plan and everybody's rocking and rolling, benefiting from all the various educational opportunities, support opportunities, risk assessment opportunities that they have available to them. So let's give you an overview of the 3 different plans that we have available to you and your team members. We have a core foundational plan, and then we have a middle ground champ plan, and then we have a concierge type of plan, which we refer to as the Tree of Life plan. Now, there are certain core features that are consistent across all of the plans. And of course, there are implementation support levels for each of the different plans. Last but not least, I want to share with you that you also have the opportunity to combine these plans with ICHRA plans and HRA plans if you wish to do so. Now, what Sankofa focuses on, as I said, is a comprehensive, risk-based, actual health care plan where we are providing you and your team with customized, accessible resources and education that they can use to promote health and well-being, prevent illness, and become happier and healthier employees. So the foundation is where we provide you, or should I say, we provide your team members with awareness assessments. These awareness assessments help each individual person to identify critical areas that they have risk pertaining to their health and well-being. We also are available to do a site assessment. In addition to this, we have individual empowerment comprehensive health risk assessment. So there's a disease risk assessment, and then there's a health risk assessment. We also give people access to lab testing at significantly reduced costs. We also give everyone on your team access to what we refer to as our online learning center, where we have several different courses where they can learn everything about things such as brain health. We have Eat to Love to learn about diet and nutrition. We have Revitalize You to learn about stress transformation. We have Heart Song to deal with emotional and mental trauma. We have also Health Detective for them to be able to do various assessments for themselves, for their family members, and to understand and be able to analyze and interpret the results of those assessments. Assessments for everything from blood chemistry panels to saliva tests, home tests that they can do to get a better understanding of what the challenges are that are sabotaging their health and well-being. We also give them access to what we refer to as weekly ABC clinics, where they can learn and get support on understanding the assessments, learn how to build the foundational pillars that support and sustain health and well-being, and learn how to engage in various cleansing and detoxification programs to optimize their health. They will also have access to virtual health clinic, what that we refer to as the Doctors RN, where they will be able to interact with our foundational healthcare providers to answer their questions. And they'll also be able to participate in our monthly Things to Know sessions, where we do a deep dive on various health topics that are identified in the different surveys that we do as a part of the site assessment at the beginning of the program and then on an annual basis. Last but not least, you can have peace of mind knowing that your team is covered with unlimited 24/7 primary and urgent care telemedicine. So if Susie's daughter wakes her up at 2 o'clock in the morning with a sore throat and coughing, Susie does not have to worry. Susie can whip out her phone and get in contact with a medical provider in less than a minute and get her needs addressed right then and there. Do you realize how many of your employees are at work fretting over the health of a child or a loved one? A lot of people are not going in to get care because they're so concerned with the bill. They don't go into urgent care for those people who don't have any kind of coverage. They're afraid to go into urgent care because at a minimum, your urgent care bill is going to be about $100 or $150, and that's before they give you the prescription for the medication. Well, now Susie doesn't have to worry about any of that because at the touch of her fingertips, she has access to 24/7 primary and urgent care telemedicine. And she is able to combine this with access to reduced prescription rates. Isn't that exciting? Doesn't that give you just a warm feeling to know that you're able to give the people on your team the care that they deserve, the peace of mind that you and they want so dearly? Now, the second level of the healthcare plans that we offer is where we start to layer onto the previous. So you get all of the benefits of the foundational plan. And in addition to that, you start to get group support services where people are going to have the opportunity to be part of community that is customized and concierge, meaning it's specific to their issues. Remember, we talked about those assessments that are done at the very beginning. Those assessments are critical because that helps us to identify what are the main health concerns or the health risks that each team member is dealing with, and to invite them into specific groups that will help them to address those concerns that are personal to them. They'll also have access to our digital guidance app. And this digital guidance app, once again, gives them at their fingertip 24/7 access to meal plans, exercise plans, stress and release plans, the ability to contact their health steward, their guide 24/7, to text that person in a HIPAA compliant atmosphere where their data is protected. It also gives them the ability to track various biometrics, such as their weight, such as their blood glucose levels, such as their water consumption, their food consumption, their blood pressure. All of these things, they're able to track that data and use it in concert with their health steward and their foundational health provider to further customize and address their specific needs. At this level, they also get an annual foundational lab test, or they can have a more comprehensive lab test where a certain amount is subsidized by you, because that amount of money that would be used for the foundational test can be applied to the more comprehensive test that is used for your higher risk clients. They also have access to monthly group challenges, such as doing a holistic cleanse, dealing with emotional trauma, dealing with stress transformation, dealing with food concerns. Now, I know, you know, that many of your employees are concerned about what food to eat. And it is so confusing. Should you do paleo? Should you do keto? Should you do vegetarian? Oh my God. So this specific challenge helps them to work out the confusion of all the information that is out there that just drives us crazy. It also gives them access to intensive group sessions with their health steward that, again, they have the ability to connect with on a 24/7 basis. And last but not least, you also have the ability to integrate a rewards and incentive program with things such as comp time, drawings for certain gift certificates, program discounts, things of that nature. You know, we've got to make sure that they are engaged and excited about pursuing happier and healthier lives. And then at the last level, we have what we refer to as the tree of life. And this goes beyond just having the group support. This now gives one-on-one support for your higher risk employees. So once we do those assessments, we will look for the top 25 higher risk employees and offer them an opportunity to have one-on-one sessions with their health stewards, in addition to being able to have the comprehensive lab test done, and also being able to have one-on-one sessions on a semi-annual basis with our foundational health providers. Now, keep in mind, once again, that all of these plans, if you wish, can be combined with an ICHRA and or a FSA or HSA plans. In addition to that, members can add on what we refer to as what-if plans. And these what-if plans can include things such as access to labs, access to mental emotional counseling, free medications, support in being able to navigate healthcare costs, and so much more. So now, to sum everything up, remember we have 3 different plans. And depending on how many employees you have, there's a price point of between $750 to $3,000 per employee. You get to choose the level of support that you are offering your employees. And I think you will agree with me that this is significantly lower than the traditional health insurance plan. Because this is not health insurance. Because in reality, health insurance is not health insurance. Health insurance is a misnomer for the reality of being disease management insurance. So let us be very clear. We are dealing with a chronic illness epidemic in our nation. That is what is driving the significant portion of the $4.3 trillion that is spent in healthcare in this country. Over 80 to 90% of that is spent on chronic illness. And it's not getting any cheaper. And people are not getting any better. As I said, when is the last time you've heard one of your employees say, I no longer need to take medication, boss. No, that's not happening. So if you choose to do nothing more than stay in the traditional healthcare paradigm, you can expect that your premiums will continue to increase, your absenteeism costs will continue to increase, your productivity will continue to decrease, your retention will continue to decrease, and the overall health and well-being of your employees will continue to decrease. What I'm offering you is an opportunity to provide the members of your team, the people that I know you care about, with the health care that they deserve. So the way in which we work is that first we do an onboarding session with the administrator. Then we do a worksite assessment with survey of the interests of your employees. Then we do a staff awareness motivation session because we got to get them to understand what this new revolutionary innovative paradigm is that I'm sharing with you, right? And to show them how they are going to benefit from engaging in this particular shift. Then we go through individual comprehensive disease risk assessments and lab testing. And then we engage in a success strategy session with the admin team once we get those results back and we have an idea of what we're dealing with. And then we do an onboarding session with the entire company. And then we have stratification based on risk and readiness score. We send out an invitation to those people who have a higher risk profile, and we give them the opportunity to opt into various different benefits. Benefits that range from the weekly ABC clinics to the monthly Q&A sessions, to the group sessions, all of these various resources that are available to them. 100% of your staff will always be covered with all of the benefits of the foundations levels. And then depending on whether or not you choose to opt into the CHAMP level or the Tree of Life level, then 50% of the team will be invited to participate in the weekly group intensives, which are done under the behest of our specifically trained health stewards. And then the upper 10 to 20% of those who are dealing with significant high risk issues will be able to have a more in-depth clinical case review and one-on-one mentorship with the health stewards and our foundational health providers. They will also be a semi-annual reevaluation where we redo the risk assessments and we have an annual worksite reevaluation in addition to a semi-annual disease risk evaluation. So I encourage you to take the next steps, to book a call with me to discuss what are the needs of your specific organization, the team members in your business. If you're a solopreneur, then that's an easy conversation because it's you. If you're an independent contractor, again, it's an easy conversation because it's you. At the very least, give us a call, book a consultation. You can scan this QR code or you can click on the link that is available below this presentation so that you can review what the different plans are that are available. And you can talk one-on-one with us to see what best meets your needs and your budget. Let's be real. Now, I encourage you to do that as soon as possible because early adoption discount, meaning that the prices will go higher. This presentation is recorded in January of 2025, and so I can't guarantee this price point for more than 3 months. Beyond that, please keep in mind that those prices will go up. So what we're giving you the opportunity to do today, we recommend that you sign with us for at least 2 to 3 years to be able to see the true transformation for your employees. And if you choose to sign with us for 2 to 3 year contract, then that price is locked in for that duration of time. At the minimum, you'll be required to sign at least a 1 year contract, which means that that pricing will be guaranteed for that year period of time. In any case, I look forward to speaking with you to determine what are the specific needs for you and your team members. Unless, of course, as I said, you are a solopreneur, in which case I look forward to speaking specifically with you about your needs. So let us look at an alternative way of being able to truly address the needs of the people on our team.